So we are going to go for acquired hypopituitarism. Okay. Acquired hypopituitarism is because of it, mainly most commonly it is because of stock effect. What is the stock being compressed by? It can be a tumor, it can be due to trauma, it can be due to infiltration, it can be due to infection. Okay, so tumor, it can be growth hormone, macroadenoma or prolactin macroadenoma. It can be non-functional tumor like craniopharyngioma or Rathke's cyst. It can be due to Nelson syndrome. What is Nelson syndrome? After bilateral adrenalectomy, increase of ACTH occurs because the negative feedback from the cortisol is gone. That is why there is a increase in ACTH following the bilateral adrenalectomy. It can be due to trauma. This is because of this is known as the secondary empty sella syndrome. Okay, secondary empty sella syndrome. Okay, that is because of bleed or trauma. This can result in the CSF accumulation. There is the rim of pituitary is intact. In case of primary empty sella syndrome, CSF will increase, ICT will increase. This is known as pseudotumor cerebri. Okay, infiltration can be by sarcoidosis, hemochromatosis, Langerhans cell histiocytosis, and most importantly is autoimmune lymphocytic histiocytosis. This is mainly a IgG4 disorder resulting in fibrosis of this pituitary. Most commonly it occurs in maximum inflammation occurs in pituitary. It's seen only in the postpartum period and associated with headache and visual defect. Prolactin will be more, ADH will be less. Okay, and the treatment is steroid. What are the infections? Infections are TB, pneumocystis pneumonia carini in HIV patients, toxoplasmosis, and histoplasma. These are the infection which can cause. Other than that, there can be pituitary apoplexy. This is also most commonly in the postpartum period. Sheehan syndrome. Sheehan syndrome. Sheehan syndrome, the pituitary doubles its size. Double sized pituitary in pregnancy. Pregnancy, the size of the pituitary is doubled. After that, this pituitary requires a lot of blood, and if there is decreased blood supply suddenly, when this can happen in a pregnant female, when can this happen? Due to PPH, postpartum hemorrhage. After postpartum hemorrhage, lot of loss of blood, the pituitary is not getting adequate blood supply. Due to decreased blood supply, it is going into necrosis. 75% necrosis of pituitary occurs. Okay. And the first hormone to decrease is the growth hormone. What happens with the decrease in growth hormone? Decreased glucose. So hypoglycemia is the first feature. And the person will not be able to breastfeed because prolactin is also decreasing. ACTH is decreasing, so there will be adrenal crisis, hypoglycemia, adrenal crisis, abdominal pain, hypoglycemia, and decreased BP. Unable to breastfeed. There will be decreased LH-FSH, that will result in osteoporosis. Growth hormone decreased weight loss. Okay, and ACTH also decreased weight loss. And there will be meningeal irritation and vomiting. Decreased BP for ACTH also. Meningeal irritation. Okay. Pituitary apoplexy other than Sheehan syndrome can occur also because of diabetes, hypertension, sickle cell anemia, Russell Viper bite. Diabetes, hypertension, sickle cell anemia, Russell Viper bite. The management is the same. It is steroids. Okay. And this is a very big emergency. So if there is hemorrhage and there is increased, if there is hemorrhage inside the sella turcica, then surgery also needs to be done. Surgical decompression also needs to be done in Sheehan syndrome. This is the whole of hypopituitarism.